Welcome back to the Self-Carapist Therapist. I'm Lorraine Moorhead, and today we're talking about complex trauma approaches that don't re-traumatize, featuring my guest, Thomas Zimmerman, who is a mental health therapist practicing in the Cleveland, Ohio area. He's an EMDR therapist, author, consultant, podcaster, and trainer who helps other therapists work more effectively with clients with severe trauma through global, on-demand, and live workshops. Today, we'll get the chance to talk about the 4 Blinks version of FLASH, EMDR, and complex post-traumatic stress disorder, or CPTSD. Please be sure to stay to the end and rate, review, and follow the show as it helps us connect with more curious mental health buffs who love to learn. Welcome, Thomas Zimmerman.
Thank you. Thanks for inviting me.
I'm so excited to talk with you more.
Yeah.
Would you share how your professional work began?
Well, this is probably my 10th career, so I've had lots of other things. And I forget if it's an old American Express commercial or what it is, but there's the commercial is these young archaeologists are somewhere in Egypt complaining about the heat. And they're like, I can't wait to retire. And then there's this old guy there that's like, I am retired. It's like this. So while this isn't exactly my retirement job, I did come to therapy in my 40s. And I'm in my early 40s, and I'm in my mid 50s. So I came to it, and really I came to trauma work unexpectedly. I mean, who would have thought that almost all we see is people with pretty significant trauma? So I didn't necessarily set out to become a trauma therapist. And I didn't know that becoming a trauma therapist would require that I'd have to do all this work myself, on my own.
Yeah,
stuff.
Darn it.
I know. So that's kind of the history is I became a therapist, and my goodness, everywhere you look, there's trauma.
Yeah. And so often it's trauma that isn't being recognized as trauma. It's sort of a set of symptoms that isn't necessarily being linked to that. At least I find that in my work.
Exactly. Yeah. And again, people have every type of diagnosis. And when I started, it was not unusual for people to have 6, 7 diagnoses and trauma wasn't one of them, but that was the one that accounts for the 7 they had. Mm-hmm. So yeah.
And how, from the beginning of this career to now, how has your work evolved, or what have the modalities that you've depended on changed?
Yeah, I started as somebody who, again, it will kind of make sense because I was someone who was still surviving in my neocortex. I was still surviving, just pretty disembodied, not very present in life and engaged in life. So I liked CBT in the beginning. I really, really liked it, but it wasn't really working very well. And then one of my friends was like, hey, you need to do this EMDR thing. And I'm like, boy, that sounds like 1950s hypnosis. I'm not sure. I want to be respectable. I want to do things that are. And then I took an EMDR training and took another EMDR training, and it seemed to really resonate. I was able to start doing some of my own kind of initial healing in it. And then all heck broke loose because, as it is, you start to do a little trauma work, and then life really demonstrates to you that whatever it is you're carrying, if you want to be a trauma therapist, you got to work on it. And you got to work on it pretty aggressively because whatever it is, whatever your weakness is, whatever your sensitivity is, whatever your unprocessed trauma is, the universe will bring that to you in massive volumes at a rate faster than you can do your own work. So then I started my own personal EMDR journey and my own kind of embodiment journey, and started podcasting and teaching and consulting about EMDR therapy. And then I took a flash training with Ricky Greenwald's team And I took it largely because people were asking me so much about it in consultation, and what I was hearing didn't make sense. So I'm like, I'm going to go do this training. I had no thought that it might be helpful. And I processed back to back 3 memories in our little 25-minute flash practicum that I was planning on spending whole hours with each, some of the multiple memories, right? And I'm like, wow, that's something. And then I started doing it with my clients, and I saw 70 clients in a row fully, permanently, adaptively resolve something with no distress. And it took all of those, took weeks and weeks and months of this for me to go, wait a minute.
Yeah.
Flash isn't a resource. So then I started really thinking about Flash, and it became pretty clear to me early on what's going on in it. What is it? How do we explain what's happening in Flash? And I had a very clear understanding of what I thought that was. And then I developed a version of it. And Flash is, Flash, for those of you that need a little bit of a backstory, Flash is developed by an EMDR therapist named Phil Manfield 9 years ago, in 2017. And it was understood as a way to take heat out of memories. You could get a memory that's 8, 9, 10, and you could make it 1, 2, 3, and then go into that memory at EMDR with much, much lower distress. And that's what I thought Flash was something that just took heat out of memories. But my clients really quickly showed me it fully adaptively processes memory using every metric that you would consider a memory resolved in EMDR therapy or any other thing. So I'm like, wait a minute. If that's what it is, we have to teach this. We have to train this. And because Flash wasn't copyrighted, and because the developers seemed to be really fixated on a working mechanism that just wasn't compatible with what I was thinking, you're allowed to, right? So they're allowed to be other versions of something if that thing is a trademark. So I developed a version of Flash built specifically for complex trauma around the very central idea of my thoughts about its working mechanism. And then that's 4Blinks Flash. And then just in the last month, 4Blinks is rebranding as Predictive Processing Flash. Oh. Because 4Blinks doesn't actually mean anything. Does that make sense? It's not prescriptive of the number of blinks. It's just, and in the version of Flash that I'm training now, we don't even blink, and memories resolve with greater regularity than when you do. So the real question is whether we keep calling it Flash. So I have to figure that out, and may have to negotiate that a little bit with the powers that be. We'll see.
Yeah. So what is your working understanding now of how this is working so fast with memories with your clients?
Yeah. So I think we largely, from a very, very top line, our brain largely updates and it learns one way, right? I mean, in all of the psychotherapies, it's not too far away from what Bruce Ecker has said very, very clearly, which is that if you want to shift something that's stuck, you need to activate it and then immediately have the client sit with a disconfirmation of that. You have to sit with something that creates a juxtaposition of that. So we heal across prediction error. We heal in Flash, for instance, when we bring a tiny piece of the memory into working memory, push it out of our awareness, and then we have back-to-back experiences that show us that bad memory is not happening. That little bitty tiny piece of the memory isn't happening because it's not happening right here, right now in our nervous system. So we're updating a little piece at a time, a little piece of the memory at a time, using experiential disconfirmation. And what I've really been focused on the last year and a half is moving away from triune brain, this idea from a guy that was born in, I think, 1912. The organization of the brain is brainstem, limbic brain, neocortex. And again, triune brain was a great model. I mean, it's a really great model, but it emerged in the 50s and 60s, and it emerged when the dominant models for trauma were characterological, meaning like, why do some soldiers, why are they so weak that they break and others don't? Triune brain came along and said, wait a minute, this isn't about character trait. This isn't your fault. As a matter of fact, you have a 150 million year old limbic brain that's running really old software, right? And that kind of was very, very helpful. And then all of these therapies now are focused on how do we settle your limbic brain so that we can access things and do other things with them. And while it's not fair to say that EMDR is primarily a limbic brain treatment, that's how a lot of people understand it. So the problem with triune brain is that we've learned some stuff about the brain the last 65 years that really, really soundly challenge it. So all of the things that and again, there's imaging now, like very detailed imaging and mapping of the brain that doesn't just show pathways, right? These neural pathways, but we can also see the direction of the flow of information. And the direction of the flow of information isn't what we thought. So what we're finding, what neuroscience across many fields is organizing around, is an idea of a predictive brain that is constantly constructing your reality from the model that you have of yourself in the world and from your right now sensory state, including your own internal sensory state. So it's a pretty elegant model that explains all kinds of things, from schizophrenia to neurodivergence to how in the world neuroplasticity works, right? So I've been carefully saying that if we have a 150 million year old brain running 150 million year old software, we're kind of screwed, right? But if you have a brain in this predictive mind model, and we can kind of talk about the elements of it if that would be helpful, but in this predictive mind model, your brain's always on. You don't have three brains competing with each other, right? You have one brain that is always on until you die. And your brain is always changing. It's always changing. It's always updated. Your limbic brain's not off and then becomes online. That's not what's happening in the brain, right? And even when we said that, we kind of understood that that's not what's happening in your brain. It's that when your limbic brain is activated, it's just a little bit more activated than its baseline. So my point is that what about a brain that's always on and always changing? With that kind of a brain, I can begin with the assumption that absolutely you can change. Absolutely you can heal. It's just the trauma parts aren't meant to be changed easily without the right type of sensory prediction error, right? Without the right type of sensory disconfirmation. So Flash is weird because it involves two things that we never, ever, ever do when we're interacting with trauma. We never look at it blindingly fast, and we never immediately pivot away and watch puppies on YouTube or funny babies laughing on YouTube. We just don't do that. So I would argue that that's one of Flash's strongest things, because people that came to EMDR probably thought EMDR was weird and not intuitive when they first came to it. Yeah. So every way that actually works is culturally non-intuitive. But that's okay, because it's the cultures that wounded us. The same cultures that wound us really do heavily shape our intuition about what traumas we're allowed to work on, about what we can count as wounding, about how we should do that work. And they will promote endlessly doing things that make perfect sense but have never worked, right? You can just avoidance, you can numb, you can repetitively catharsis something for 30 years and it won't shift because you're not having prediction error. You're having the same repetitive ruminative process over and over and over. But that's what makes sense. That's what makes cultural sense. So Flash is weird. And people say, there's just not enough distress in it for me to believe that it's weird, even though your client just told you that they healed from something.
Yeah.
Yeah.
Yeah. That is interesting. Because looking at the puppies or looking at the bunnies in that moment does lift the feelings of distress. And it sounds like, I think what I've noticed with it is it from that point, it isn't necessarily transferable to the next time that trauma comes up. Is that your experience?
No, Flash fully adaptively, permanently resolves memories.
Yeah.
Period. Right? Fully resolves memories. While the journey's different than EMDR, the destination's the same.
Yeah. Okay.
There'll be no distress. There'll be a positive belief. There will be some generalization because that's what healing does. So Flash resolves memories. And when I say that, what that means is that Flash has to become an approach to psychotherapy. Do you see how we've been told what Flash is, that it is this little hack, it is this little tool, it is this thing you can do.
Yeah.
But if what's wrong with us is the transgenerational trauma we carry. Does that make sense? If what's wrong with us is this big, huge, the longest public health crisis of our species, which is that, we're still living out unresolved trauma of the Middle Ages.
Yeah.
Do you know what I mean? We're still, right?
IFS calls that the legacy burden.
Yeah.
Just that what we have with us before we even.
And if that's what's wrong with us, if we don't have a single problem, all of our intractable problems, none of them are going to get solved until we solve the trauma problem. Right? So if that's what our problem is, and you have a way to resolve memories that even the most severely complex clients, the vast majority of them, can do easily, effortlessly, and without much risk of decompensation, don't tell me that can't. Psychotherapies have been built around less than something that fully adaptively resolves memories 95% of the time in a single session.
Yeah.
So that's what I'm on. That's the mission that I'm on.
Yeah.
And part of what I'm doing in Cleveland, I'm starting a nonprofit in the next 6 weeks to do original research into predictive mind stuff, including Flash.
Oh, fantastic. So we had talked a little bit about the possibility of maybe doing a demonstration of how what we'll now call the predictive processing version.
Flash, yeah.
Work. So is that something that would feel good to
absolutely
demo now?
Absolutely. And we'll walk through the resources because the resources are really essential.
Yeah, I think that's something that you do very well. But also I love that about EMDR and some of these that's something I think some psychotherapies overlook.
The way I describe it, the resources are like, they're like the four walls of the chimney that allow us to do this work without significant risk of the house burning down.
Yeah.
Okay. Good. So, So I need to do a quick orientation first, because in order to do it well, you need to understand that what I'm going to be asking you to do is non-intuitive, right? So again, if you're driving, you turn the wheel left and your car goes left.
Yeah.
Does that make sense? In Flash, what we're going to do is we're going to turn the wheel left and the car's going to go right.
Okay.
Or we may turn the wheel right and the car's going to start backing up. Do you know what I mean? So the regular mechanisms that we do when we start to feel things and start to get activated, we're going to need to insert new processes in there.
Okay.
And it's not going to feel right.
Okay.
Right? So good. So the very first resource is the very first resource is container. And it's not EMDR container because we're using it very different than that. Okay. So the container can be a box. It can also be a motor movement. Do you know what I mean? Because we're going to be looking at that memory so quickly that only a little tiny piece of it comes out.
Okay.
And you need to send it away from you. So do you think you want to practice it with the hand, or do you think you want to build a box in your mind?
I think let's practice it with the hand.
So as you just do that, like what's that feel like?
It feels like a release.
Yeah. What we want it to do, what we want it to send the message is that whatever I've just activated, whatever I've just caught, it's moving away from me. I'm not thinking about it. I'm not feeling it. I'm not noticing it. And goodness sakes, I'm not noticing it. Does it make sense? So a lot of people think that Flash is like the Mandarin orange to EMDR's orange. It is not. It's a completely different thing. So if EMDR is an orange, Flash is a kitten, and it's not even an orange kitten. It's a gray kitten.
Okay.
Right. So there's absolutely nothing that's going to be, there's nothing that's going to be helpful in EMDR to help you understand how to do this version of Flash well, and vice versa. Okay. So that away. We're not thinking about it, feeling it, seeing what it connects to, ruminating, none of that. It is going away. And ideally it is going out past the planet, the object formerly known as the planet Pluto. It's just gone out of the solar system. Okay. So we'll try that and see how that goes. Okay. Good. The other resource is shock vac. And somatic therapists are like, Tom, don't tell me we're going to vacuum distress out of the body. We're going to vacuum distress out of the body. Because from the predictive mind point of view, we're wanting your mind to reach the conclusion that that little piece of the memory isn't happening. And the way we do that in Flash is we make sure it's not happening in your body. That little piece of the memory can't be happening in your body. If it's happening in your body, your mind's not going to update it as over because it's happening. And now your mind's got to make predictions about what it means that it's happening in your body. And that's going to keep it stuck. So if you can catch whatever's distressing here, you're going to use the hand or you're going to use a container. Now, just thinking about a memory makes it show up in the body sometimes. So the shock vac is the resource for body-based distress, not your normal Monday morning stress.
Yeah.
But what just got worse when you looked at that memory? That's what we're like vacuuming out. Okay.
Not this stress, this stress.
Yeah. It's whatever got worse when you just looked at that memory. That's got to not be in your body. Okay. So have you ever used a vacuum before?
No.
Not of any type.
A vacuum? Yes, I've used a vacuum before. Yep.
Okay. Have you ever pulled the hose off a canister vacuum to like do a couch or do something like that? Okay, good. Can you get in touch with that memory? The sensory thing of like using that hose?
Yes.
Okay. Good. Can you notice like how strong that like suction is? Can you like imagine, I don't know, vacuuming up some Cheerios? See them just go right into that hose.
Yeah. And even the power of the motion, even when you disconnect it, it's really all of a sudden very powerful.
Yeah, good. And it's a very, very powerful vacuum, and they're loud. They're like, really, So good. And while we're not vacuuming your normal stress, I don't want to activate you to test it. So can you find a little bit of residual stress or anxiety anywhere in your body, even if it's in your head or face or anywhere in your body? And can you imagine just turning your vacuum on and then just vacuuming it out, like kind of like using your hand where the hose is and wherever it is, just kind of vacuum it out.
Yeah, I'm doing the motion on my chest.
Good. And don't let it pull your skin, but see if you can see some of that stress leaving your body like a kind of colored smoke going into that hose.
Yeah, I'm visualizing some yellow smoke.
Good. And you don't have to get all of it, right? Just can you get some of it? Okay. Now your shop vac canister is your container. Okay. And then you pick it up and then it goes past Pluto. Awesome. Okay, good. Now, can you imagine a warehouse empty that we just fill with copies of your vacuum? Do you know what I mean? So anytime you need a vacuum, one shows up. How does that sound?
Yeah, that sounds good.
Okay, awesome. Good. The third resource is pleasant scene. Funny scene, engaging scene, beautiful scene, relaxing scene. I don't want it to be imaginary. I'm putting you on the spot here because I'm going to make you open up other windows. Okay. I don't want it to be imaginary. Okay. So have you seen something lately? A video of something that was funny. If you needed to distract using a YouTube video, what type of video would be helpful?
A baby doing something funny.
A baby doing something funny. Can you open up a window on your computer? Open up a window on your computer and go to YouTube and search for funny babies or whatever search term feels appropriate. Or if you have your phone, you can also do it on your phone if you don't want to multitask on your
Okay.
Yeah.
Okay, opening it up. Okay, I've got a funny baby compilation.
Awesome. Yeah. Good. Excellent. So what I'm going to do is I'm going to give you about maybe 45 seconds to just watch it. Okay. And the sound can be on. It probably should be on a little bit.
Okay.
Right? And again, ads may show up. That's okay.
Okay, I've got funny babies cracking up.
Awesome. And is that shifting how you feel in the present moment pretty quickly?
Yeah.
Okay, good. Let's assume that will work, and you can change it at any time if you need to. Okay, good. Our last resource is sensory grounding, and it's vitally important because we're going to look at that memory lightning fast, but that memory might grab you and pull you in. And that's only a catastrophe if you can't find your way back to the present. Okay, so do you have something near you that you can use for the sense of smell?
Yes.
Or taste? Do you have a
coffee?
You have a coffee. Perfect. So
my smell and taste of choice.
Awesome. What I invite you to do is we're going to check each of your senses for just a few seconds. So this whole grounding exercise should be over in about 40 seconds.
Okay.
Okay. And if parts of you think that's okay, willing to try that, then what I invite you to do is just look around your current room, notice whatever objects you see. Notice if you were to touch each object, would it be hard or soft or some other texture? Good. If you have a piece of furniture near you, touch it and notice, is it warmer, cooler, or the same temperature as your hand?
Okay, cooler.
Okay, good. I'm going to be really quiet. Notice whatever you hear in order of loudest first. Good. Okay. If you have something near you that has a smell, feel free to engage in that. Good. And if you have something near you that has a taste, feel free to engage in that. Excellent. How was that?
It was good. And I saw you doing it with me.
Absolutely. Good. And which of those feels like it was most connecting? Most anchoring.
When I smelled the lip gloss, yummy
Okay.
gummy flavor.
Awesome. Good. So if you're having trouble microactivating that memory, if what we're trying to do is this and what you get out of it is a London street bus, then we'll start with smell.
Okay.
Does that make sense?
Yes.
Okay. Awesome. Good. So I need to walk you through a little bit about what procedurally, because those are our four resources are container or this, right? Shop vac, calm scene, and sensory grounding. Those are our four resources. Okay. But in order for you to do this, I need to explain what you're doing because it's going to be happening so quickly that if I don't explain it, you're likely to default to what you normally do.
Okay.
Okay. So what'll happen is I'm going to ask you in a minute, is there a memory you want to work on? I'm going to ask you, is this a specific individual memory that happened at a particular place and time? Then I'm going to ask you, do all parts of you think working on that memory is a good idea today? And if not, I'm going to help you negotiate with your parts to find something that feels like a tolerable and a good idea to work on today. I will say, don't reach in and grab the biggest monster if you're not already a flash ninja. Do you know what I mean? You need to already be a flash ninja to work on monsters, right?
Okay.
So, and then what we'll do is I need to orient you to this thing because it's a little bit different than what you may have done if you've been flash trained before. Can you find an object in your current room that you can look at that easily? Do you know what I mean? That's like on a shelf or that you don't have to turn all the way around to see. Can you find an object?
Yes.
Okay. Because I want to give you several options because there's no blinks anymore.
Okay.
You can do blinks if you want, but what the blinks do in this version of Flash is they disrupt your focus on your pleasant scene to generate a large number of pleasant scenes. So in the blinking, imagine I'm your pleasant scene.
Okay.
Okay. This blink disrupts that. And then you go back in and you have a new exposure to it. Okay. Imagine I'm your pleasant scene. Now look at the object in your room and then look back at me. The same thing happens. You just disrupted focus on your pleasant scene. What I'm also doing in the live trainings that I do is I ask people to write numbers randomly from 0 to 9 on a piece of paper. And instead of saying blink, I say a number. And they look at that number and then they go right back to the video. So of the things that I've suggested, you can blink. You can write numbers from 0 to 9 on a piece of paper, or you could look at an object in your room or on a shelf. Which of those would you like to start with? Because they're all pretty equally effective.
I'll look at the object.
Perfect. Good. So what will happen is we'll select your memory, but we're not going to activate it. Does that make sense? I'm going to say, and you don't even have to tell me what it is.
Okay.
Okay. You're just going to select it. We're going to push it out of awareness and have you look at a ceiling, blank it out. And then I'm going to say, good, load up your calm scenes. You press play on YouTube. And then every 5 seconds for a duration of 30 seconds, I'm going to tell you what's the object you're looking at.
A picture of my kiddo.
I'm going to say picture.
Okay.
And then you just look at your picture. And as soon as you see your kid, you look right back at your video. Okay, good. One quick thing that we haven't talked about. The pleasant scene cannot intersect the memory that you want to work on in any way. So it can't be about kids. It can't be about...
And I'm going to, for the purposes of entertainment value, I'm going to tell you what my distressing thing was, just so, if that's okay, so folks following along can follow.
Good. And I'm going to ask you to tell me very little about it, because if you tell me, the whole thing can come into working memory, and we're going to try to bring a slice of it in at a time.
Okay.
Awesome. So That's how we do the calm scene with picture, right? And every 5 seconds, I'm going to say picture. You look at it, look right back at your video.
Okay.
Okay. And then we're just going to do those rounds until you have a hard time finding what's distressing in the memory. And then I'm going to have you walk through the bad memory, each frame at a time. Okay. Digesting each piece as we go along.
Okay.
Okay. So that part of it is from Ricky Greenwald's version of Flash, that walking through the video and making sure we're not leaving any debris is what make sure that reprocessing is happening. So make sure that we're not just taking heat out, but we're fully permanently resolving the memory.
Okay.
And then when you're able to play the bad memory from beginning to end with no distress on any channel, not in thought, not in emotion, not in body, and not in the memory itself, you're done.
Okay.
Okay.
Sounds good.
Awesome. Good. So very quick safety things. If distress is coming, it must be moving away from you. If distress is building in the body, as an EMDR therapist, we let distress build. In this version of Flash, if you have 1/20th of 1 ounce of distress in your body or in your mind from that memory, it needs to be moving away from you using one of the resources that we have.
Okay.
So don't push into distress, period.
Okay.
We work one memory at a time only, period. Because if you let in 2, that same door might let in 27.
Okay.
Okay. Does that sound okay?
Yeah, that sounds reasonable.
Okay. Awesome. So is there a memory you thought you might want to work on today?
Yes.
Okay. Do you want to say a tiny bit about it, even though I don't usually do that? You want
to? Yes.
Good. Mm-hmm.
Internet challenges at an opportune moment.
Okay. Good. Excellent. So, good. Is that an individual memory that happened at a particular place and time?
Yes.
Do all parts of you think working on that memory is a good idea today? Check.
Yes.
You're not getting it the wrong ball. Lean into it and check. Make sure that you're not getting a no, right?
Yeah, I'm not.
Okay. Excellent. Good. So just push the general idea of that out of awareness. Look at a blank ceiling. Look at a blank wall if you need to. When it's gone, load up your calm scene. And then just be in your calm scene. It's your calm scene. It's where all the work's going to be done. Be in your calm scene. Good. Let me know when you're there.
Okay, I'm there.
Good. Good. Picture. Look at your picture and then go right back to your video. Yep. Good. Picture. Good. And as soon as you see it, go back. Yep. Good. And then just be in your pleasant scene. Good. Picture. Picture. And picture. Good. And the first time we're in this step, we repeat it. How did that go? Were you able to?
Yeah, it went well.
Good. Let's do it again. Yep. Okay. Calm scene. Let's be in your calm scene. Good. Picture. 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 And picture. Okay, good. How did that go?
It went well.
Okay, good. Now, here we go. We're going to touch that memory the way you touch a hot skillet with a wet finger.
Okay.
Just that. I mean, if you get more than we're going to have to use a resource to manage the distress. Okay. Yes. So lightning fast, think about the bad memory, whatever's distressing, catch it, contain it, send it far, far away. Don't get a big piece. Good. Send it far away. When it's gone, calm scene. And if anything shows up in your calm scene, let me know. If it's not your calm scene, let me know. Good. Picture. 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 Okay, good. How'd that go?
It went well. I felt more joy
Awesome.
in my calm
Excellent.
scene.
All right, here we go. Lightning fast. Think about the bad memory, whatever's distressing, catch it, contain it, send it far away. When it's gone, calm scene. Good. There you go. Just be in your calm scene. Picture. 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 And picture. Okay, good. How'd that go?
Good.
Okay, really quickly check your body. Make sure that no part of that memory is hanging out in your body. If it is, vacuum it out real quick. If not, we'll keep going.
Yeah.
Okay, good. Lightning fast. Think about the bad memory, whatever's distressing. Catch it, contain it, send it far away. When it's gone, calm scene. Good. Picture. 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 And picture. Okay, good. How'd that go?
Good.
Okay, good. Very quickly, think about the bad memory, whatever's distressing in this millisecond, catch it, contain it, send it far, far away. When it's gone, calm scene. Just be in your calm scene. Good. Picture. 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 And picture. Okay, good. How'd that go?
Good.
Okay, good. Don't check now, but when it's hard for you to find what's distressing in it, let me know. In the bad memory, when you look at it quickly, as it gets harder for you to find what's distressing, let me know.
Okay.
Okay, cool.
It is.
Okay. But you're still able to find it in like 5 or 6 seconds. It's getting harder, but you're still
I have the
finding
memory, but I'm not noticing any distress.
Okay, then let's do this. What I'll have you do is I want you to play the memory from the very first frame and raise your hand when you find the first little piece of distress, even if it's a 0.25.
Okay. Okay.
Yep, catch that, contain it, send it far away. Just if you need to, if it's in your body, you got to scoop it up and send it away. Okay. Good. Is it gone?
Yeah.
Calm scene. Good. Picture. 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 And picture. Okay, good. How'd that go?
Good.
Okay, good. That piece of the memory that just had distress in it, is there any distress in it at this moment?
No.
Play the memory forward and let me know when you find the next piece of distress.
I noticed a
Okay.
compassion.
Okay. Good. Can you go back and play it in the beginning and
All the
just
way through.
see all the way or until you get to the first piece of distress or until you get to the end of the memory?
I got to the end.
Okay. And no distress on any chat.
No.
No? Okay. Is there something that's easier for you to believe about you related
Yeah.
to that memory now than before? Do you mind letting me know what it is?
About me is, I guess, that mistakes happen and it's not my I don't cause them or deserve them or anything like that. They just happen.
Yeah. Yeah. And what would it mean about you if mistakes happen and you don't cause them and you don't deserve them? What would that mean?
That I'm okay.
Okay, good. And how true does I'm okay feel when you look just at that memory? Does it feel a
That feels
little
true.
bit, does
No,
it
that
feel,
feels true.
pretty
Yeah.
solidly true?
Yeah.
Okay, good. Yeah. And again, that's what we find in Flash is that there's usually a belief that's already installed as a byproduct of that memory resolving. So
Yeah.
we're used to thinking
Interesting.
EMDR shifts cognition. So healing does. EMDR is just a really good way to do it. But Flash is another way to do it. And what a memory resolving means, among other things, what a memory resolving means, regardless of how you do it, when you do it fully permanently, what that means is how you think about yourself in the world is shifted, period.
Yeah.
Every time. If not, there's more work to do. That memory's not resolved, right?
Yeah.
It means that memory feels like it happened when it did, instead of like happening IMAX in our awareness right here, right now.
Yeah.
And then all parts of you are aware that it's over. Does that make sense? And you're experiencing it as something that you have survived rather than something that is happening right here, right now.
Yeah.
And working
Totally.
memory. Yeah. So cool.
Cool. To recap, I'm in the calm place. The object I picked obviously was another cool one, something that I liked to see. Tell me again, now that I've gone through it, what the shift in focus is doing.
So you can blink. So, okay, look, you were in your pleasant seat.
Yeah.
About 30 seconds at a time. But I kept pulling you out of it to go do something else.
Yeah.
And what the something else is, whether it's blinking or whether it's looking away or whether it's finding a number,
yeah.
Or I've even tested it where I developed an app where your YouTube video blinks for you. It goes away for 1 second out of 7. You don't even have to blink and Flash still works. So what that means is that blinking isn't the working mechanism in Flash. It is the large number of experiences.
Okay.
So what the blinks do, or what the looking away does, is it turns your 30-second exposure to that pleasant scene into 6 little bitty 5-second exposures. So the disruptions create 6 little bitty tiny calm scenes in 30 seconds. Gotcha. And one of the things Flash teaches us is that it may not be, because I've also dismantled it informally here to where, you know what happens if you don't blink with a really bad memory? The memory still resolves. It just takes 2 hours. If you just are in it for 30 seconds, it takes 2 hours because it takes longer to get to the hundreds of exposures that the blinking or the looking away give you.
Yeah. So from an experiential perspective, that's a trip to hear again. I mean, I know we talked about it at the beginning and I think you were watching this and could kind of time the picture looking with this, but I noticed there were things in my calm scene. I watched the same 30-second clip on repeat the entire time. I'll put it over our video here. But I could see things in the video that I hadn't seen at any other time. And I was cracking up about things that stood out in the video time 15 that I didn't catch in time 1. And there were parts that were funnier and bringing up more joy for me as time went on, even though you would think it would happen the first time. But because I got that clip redistributed and I had all those mini calm scenes because of it, I saw it bring on more joyful emotion. Yeah.
Excellent. Do we have time to talk about kind of neurobiologically what may be going on here?
I have, if you do, I do.
So one of the things we're doing in Flash, so I need to talk a little bit about the predictive mind first. So we have this whole model in our minds, deep in our minds. There's this model of ourself in the world that has been built from everything we've ever been through. Okay? Yeah. That model is the beginning of our perception. Does that make sense? Every single thing. And we understand this because we may have people in our families who have a completely different model of like the world than we do, right? Sure. In our head. So we have a model of ourselves in the world. And what happens is our brains make predictions based on that model for about what we're about to sense. Mm-hmm. Right? And what we're about to feel, what we're about to everything, right? So our brain issues a large number of predictions from deep in our brain that go down toward the sensory regions of our brain about what our brain thinks we're about to experience. Okay? And then that flow of predictions meets the information that we are sensing right here about the nature of ourselves, the world. And when there's a mismatch, prediction error is returned. Not the information, but error signals are returned. And those error signals, our brain has really two choices. It either has to then, from those error signals, issue new cascades of prediction, or it has to update the little bitty tiny piece of the model of the world from which those predictions were made. And then the part of this so we've got model of ourselves, we've got predictions, we have mismatch, and then prediction error. And then we have this thing called precision weighting, which is basically your unconscious's attention. It's what in all of this is your brain largely unconsciously attaching attention to. What is it attending to and is assigning as important? And what is it ignoring in this massive flow of information that's just mind-blowingly fast and complicated? So that's kind of like what a brain is. And it's not just trauma, and it's not just perception, and it's not just language. We need model prediction error, and precision weighting in order to do smooth movement. We need that in order to navigate the world. It's how our bodies manage sodium and heart rate and body temperature. Almost everything a brain does it based on model, prediction error, and weighting. So what we're doing here is we're thinking about therapy in terms of that brain. Does that make sense? So how do we deliver therapy according to a brain that seems to be fundamentally wired that way? So in Flash, what we're doing is we're bringing a tiny piece of the memory into working memory. We push it out of working memory. That feels like avoidance, but it's not. Because when you bring something into working memory, your brain must make predictions about it.
Yeah.
And then some of those predictions are going to be, oh, I don't like this. This isn't safe. This isn't good. But what is your experience of that? It's puppies. It's laughing babies. Does that make sense?
Yeah.
And then that is returned as prediction error. And what is the prediction that I want your brain to ultimately make? Is that it's not happening. Does that make sense? And not the memory's not happening. We're not even targeting the memory. We're targeting the little bitty tiny piece of it that you just activated and set out of awareness. So things we bring into working memory are a little bit sticky, and we have some time. From research and from many other things I've read, we're so used to thinking about a memory as being like a bowling ball that's either in your hand or not.
Yeah.
And what Flash teaches us is that it's more like a beanbag, and you can process a memory, a bean of it at a time, a little bitty tiny element of it at a time. And from a predictive mind, do you know what a little bitty tiny slice of something is? It's not that evolutionarily important.
Yeah.
Does that make sense?
Yeah.
It can change very, very easily if you give it the right type of sensory disconfirmation.
Okay.
Right? And this is just like Bruce Ecker's. So predictive mind's up here. Bruce Ecker is here in his kind of articulation of memory reconsolidation. And then all of the transformational psychotherapies are here and how they do it. So it's just kind of different levels of abstraction for how we look at the brain and what the brain is doing. So from that perspective, having just seen this, when I say this, how does it feel? Your brain is always on. Your brain is always changing. There is no doubt that it can update. It's just the trauma parts are sticky.
Yeah.
And they aren't meant to be changed without giving them the exact right type of sensory disconfirmation so that it can update and learn that it's not happening here right now.
Yeah, that makes sense. Yeah, I think that was great. I hope it's helpful for folks listening or watching to notice how that happened and then hear the process again. Yeah, really neat. Do you incorporate this? I know you do consultation work and things like that. Do you do this method with the therapists that you're consulting with?
I do flash trainings.
Yeah.
With the stuff. And again, I end up doing them when the world goes especially crazy.
Yeah.
So I've done a whole lot of Minneapolis and Minnesota flash trainings.
I've received a few.
Yeah. And, but typically I'm usually doing flash trainings every other week. And I've been doing that for 4.5 years. I've been doing flash, this version of flash training, 4.5 years. And I do free consultation. So the flash training's free. And then the consultations are free twice a month. And then every week I do a free, people who are trained in this version of Flash can come to a free weekly therapist self-care Flash group where I go through a whole room of people. I walk them through Flash in the group format. And we spend 75 minutes just processing our own stuff because therapists need to be.
Yeah.
Yeah.
What makes you motivated to offer such accessible trainings for our peers?
For me, it's not, I gotta say it. I'm a poor kid from Louisiana. Does that make sense? I don't need more money. I'm an EMDR trainer. I make plenty, I'm a consultant. I make plenty of money. What I need is a more equitable world. Does that make sense? What I need is, and again, people are, why are you doing this? I'm like, why the hell are y'all not? Do you know what I mean? Yeah. It's like, if this were a pill, the ability to process trauma with remarkably little distress is one of the biggest discoveries in our field and with nearly no risk of decompensation. And that is not a trauma-informed thing to say. But in Flash is just not, when you do it well, it is not associated with significant risk of your client decompensating. If that were a pill, we'd all be taking it. I mean, it'd be bigger than anything else. Do you know what I mean? What we can learn from Flash, what we can learn from the predictive mind, of which I think Flash is just a really, really clear example of the predictive mind at work, is going to change how we deliver mental health services in my lifetime. It is going to. It has to. So why, if that, and again, what really got me to do this, think about this. The moment it became clear that Flash was resolving memories, I go, wait a minute. Do you mean to tell me through all the bad wars, like through all the bad moms, right through all the men, right through all the terrible flu and epidemic weekends where people could lose half their family? Do you know what I mean? Through all of this stuff, we've had the ability to pretty easily and uneventfully reconcile ourselves from our past. We've had the ability to do that. Are you kidding me? So this is important work.
Yeah.
This is important work. And it's our work. It's us. We're the ones that are doing this work in the world. It's our work. So, I spend a fair amount of my time doing Flash, teaching and all of that. And I am absolutely certain when I'm in my last few minutes here, that's going to be some of the work I'm most proud of. So why not do a little bit of pro bono work? Why not do a little bit, right? Why not?
Yeah. I'll help us wrap up here, of course, too, just to be conscious of your time. But you mentioned you had some previous careers. Was one in marketing?
No.
No.
I'm an introvert. As a matter of fact, I ran prior businesses into the ground because I was like everything was about process and none of it was about,
Interesting. Yeah. I ask that because you have had such a way of connecting to our therapist community, I feel. I was going to say this earlier, but I had a few different, completely unrelated people send me a notice about the Flash trainings that you've been doing because of the discord and, trauma happening. And I just thought that was so neat. And I said, I get to talk to Tom next week, but I just thought it was so neat that so many people are connecting with your work.
Yeah. I think what people connect with other than Flash, like the people with that EMDR that connect with my work, is I talk very clearly in ways that are recognizable to them about what complex trauma is.
Yeah.
And it's not marketing that prepared me for that. It's having a complexly traumatized nervous system that taught me how to talk about it in ways that are really clear and hopefully accessible. Yeah.
Yeah. I find myself using your metaphors on here a lot. I used your boat and whale one in episode 3.
Yeah. I've gotten some, the initial reviews for the book were fantastic. One of the latest review is, there's so many metaphors. Oh my goodness. Can you just be more concrete and like stuff? And I'm like, touche, I'm not your person if you don't like metaphors. But if you're a metaphorical person, my book has a metaphorical index. It's one of the few books in the world that has an index of the metaphors.
Yeah, I loved that. And I think for a lot of clients, that makes stuff that we talk about every day that makes sense to us really palatable for them and understandable.
Yeah.
And just a final question that I like to ask everybody that comes on, what is your perspective on self-care, either for yourself or what do you suggest to your clients?
Yeah, I do a fair amount of Flash.
Yeah.
I do a fair amount of Flash. It's gotten me through some difficult times. It's gotten me through some difficult interpersonal stuff. It got me healthy enough to leave some stuff that wasn't working.
On yourself?
Yeah. Yes, Flash is 100% effective self-administered.
Okay.
It works almost every time, self-administered. Just like, and it gets and again, it's amazing because what we're literally doing is we're talking in the language of the predictive mind.
Yeah.
we're working in the language of the predictive mind. So, so other forms of self-care, it's probably just important to know. I work too much. I do. I have since I was 18. Do you know what I mean? I work too much. So part of what self-care is trying to figure out, how do I take care of myself? Do you know what I mean? Like, I'm at the point where now I'm like, okay, let me go see these doctors. Let me go see that doctor. Let me go see, right? So, and then also recognizing I can't keep doing this. Does that make sense? I can't keep up
going at this
pace,
speed. Yeah.
This pace, the speed. I can't keep doing it. But every therapist that's excited about something is a busy person.
That's so true.
Does that make sense? So
makes total sense.
So yeah, I mean, I do Flash. I'm trying to take care of myself, but I'm telling you, there's something amazing about our profession, which is that if you're on to something, do you know what I mean? If you're on to something, there's not a day that you wake up that you don't think that this work isn't important. Does that make sense? So that's pretty good self-care too, is that even if I'm going to burn myself up, I'm going to burn myself up over the things that matter. So at least that's what I'm telling myself right now.
Yeah, I love it. I relate on some level to that as well.
Yeah.
Tom, thank you so much for your time.
Thank you so much. Thanks for having me. Okay, bye-bye.
Bye.